Health innovation is more and more about convergence every day. When we bring clinicians, basic scientists, computer scientists, and entrepreneurs, we get to better understand the disease and the treatments that make people better. Today, we're highlighting a special relationship between Medicine by Design out of the University of Toronto and the Ajmera Transplant Centre from the University Health Network. Together, these organizations are bringing the future of regenerative medicine into reality. I spoke with the Executive Director of Medicine by Design, Michael Sefton. Hi, Michael.
Hi.
Tell us a bit about yourself.
So I'm a professor of biomedical engineering at the University of Toronto, and I'm the director, run a program called Medicine by Design. It's a multi-institutional initiative to bring people together to focus in on regenerative medicine.
What kind of different clinical domains, research domains, who works in Medicine by Design?
So our hallmark is convergence, that we bring together different disciplines, engineers, biologists, clinicians, all focused in on selected problems in regenerative medicine. Nobody knows everything about the right topic. I might know how to make a right kind of biomaterial, but I don't know what to do with it once I've made it. And so we redirect the kinds of things we're doing to the right kinds of problems. Clinicians are busy, and so the idea is to go to where the clinicians are being trained and teach them about regenerative medicine, teach them about what can be done, give them some practice engaging with engineers who provide other skills and other technologies that will benefit the kinds of work they're up to.
I recently met with Sonia McParland, Senior Scientist at the Ajmera Transplant Centre at University Health Network. She and her team were instrumental in mapping out the human liver and its regenerative capacity. You and your group did some research on mapping the liver. Maybe tell us a little bit about that project.
Sure. So this is a really cool project, and it came from a gap in the literature. We didn't really understand the cells that make up the liver. And so what we did is we took human livers and we took them down to a single cell level, and we performed something called single cell RNA sequencing. And so we were able to look at each individual cell and see what these cells look like in terms of what genes they express and what they might be doing in the human liver. Medicine by Design brought all these people together. And it sounds kind of simple, but it's the most important part. This collaboration is made up of engineers from the University of Toronto, computational biologists like Gary Bader at University of Toronto. All these people are wonderful liver researchers in and of themselves, but they would never all be in the same room together before and funded to kind of do a high-risk, high-reward project. So Medicine by Design brought everyone together and kind of got them all looking with a laser-sharp focus on the same question.
Medicine by Design and Ajmera Transplant Centre work together to make sure basic science researchers connect with frontline clinicians delivering patient care. Dr. Atul Humer from University Health Network explains how working with Medicine by Design improves research projects.
So we're a very large organ transplant program performing about 700 transplants per year, including kidney, liver, heart, lung, pancreas, and bowel transplants. Well, one of the key strategic directions in our program is research, and specifically research into how we can better improve organ function and repair and regenerate organs. And this is exactly what Medicine by Design was working on. I think it's really critical because it gives our clinical trainees a scope into what's going on the basic science side, and it allows them to really figure out how to translate the basic science research into clinical practice.
Now that we've got this engine, we've got to go the next step, and the Ajmera partnership is important there to bring in the clinicians who have the unmet need and who can have the patients we can apply this to or can be the first adopters of it. The goal is to make Canada, Toronto, the destination for regenerative medicine to address these big problems to prepare the future of human health.